why we're so good. We look at you and we think of your whole self. Is your heart good? Is your lungs good? What are we doing for this? How can we prevent diabetes down the road? Different things. How's your diet?
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gal here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Megan Stewart, who is a board-certified family nurse practitioner with over 15 years of nursing experience, and 8 of those as a nurse practitioner in vascular surgery and wound care. Now practicing in aesthetic medicine, Megan brings a powerful blend of clinical depth and artistry precision to every treatment. Her holistic approach emphasizes preventative care, patient education, and long-term wellness, not just quick fixes. Megan is passionate about empowering women to feel confident, healthy, and informed as they navigate their beauty journey. So Megan, welcome and glad to have you here.
Thanks for having me. I'm excited.
Yeah, so Megan, let's dive right into it. How did you first get interested in medicine?
Yeah, so ever since I was a kid, I always knew I was, wanting to go into the medical field in some way. At first, I really thought I wanted to go to medical school. But then I learned about all the schooling and everything. And so I didn't really want to do that. So then I switched to nursing at a young kid and never changed. I've always wanted to be a nurse in some capacity.
Okay, so then how did you make that transition then from vascular surgery and then eventually making your way over to aesthetics?
Yeah, so my background as an RN was always surgical in some way, med surg, vascular, cardiothoracic. So I knew that, surgical type procedure, aspect was what I wanted. And so when I came out as a nurse practitioner, I went into vascular surgery. I did that for, many years and was really good at it, loved it. I just was working all the time. So I have a young daughter at home, and I was distracted by work all the time and I needed more of a work-life balance. So I transitioned into wound care. I did wound care for a few years. And a good friend of mine was the injector at the local spa. And she was relocating with her husband to Scottsdale, Arizona. She knew I had always been interested in aesthetics, but intimidated by aesthetics. You got kind of got to know somebody or have an opportunity to jump into it. And so she called me and she said, I don't want to leave my patients with just anyone. I trust you. I know you'd be good at this. Or, are you interested? And I said, yeah, absolutely. And so it just kind of fell in my lap and it was perfect timing.
Okay, so basically that's when you decided to start your own practice. It wasn't like you worked
Mhm.
for a practice before, like a aesthetic
Right.
practice, and then
No,
you
this is,
just dove right
yeah.
into it.
Yes, I joined a Beautiful You medical spa.
Ah,
Hmm.
okay, got it.
Yeah.
Okay, so then what are some of the most common treatments that your clients and your patients come to you for?
So I'm the nurse practitioner in the office, and so I, kind of oversee all of the medical aspect of anything that we, come across in the office. My primary responsibilities are all injectables. I'm the only provider that does injectables, so all of your Botox fillers, veins. I do a lot of sclerotherapy, and also just in general consults.
Okay, got it. And for all those treatments, I mean, is there are ones that you're finding that are really, really popular, ones that maybe are not so popular, or ones that are starting to become more and more popular?
I think that something that's kind of becoming more popular is skincare, preventative skincare. And I love to see that. It starts with skincare. And I think that that's something really, it's young girls are really the ones that you're seeing it the most in. I mean, my daughter is obsessed with her skincare right now. She would, break me if I let her. But uh, now it's kind of trickling into adults, and adults are realizing like, hey, my daughter is using better skincare than I am. And so you're starting to see a lot of adults coming in, 30 to 40-year-olds especially, and they're going, I want Botox, but should I be doing something different about my skin? I know I'm not very good at it. And so I think that that's really hot right now is just really good medical grade skincare and counseling a lot on, appropriate skincare for different skin types.
Okay. And could you explain as far as the differences and maybe even the complementary ways that skin health and the prevention ties into injectable. So I guess to rephrase that is that if I just focus on skin health and prevention, do I need injectables? Or
Mhm.
do I just need injectables, but I don't necessarily need the skin health prevention? Or do they both tie
Mhm.
together?
Yeah, absolutely. I literally just had this conversation this morning with someone who came in. She's never really been great at skincare. She's never had injectables before. She's starting to develop fine lines and wrinkles. And she, thinks I just want Botox. But it has to go more deep than that. And so I counseled her on appropriate skincare because it starts with your skincare. If you smoke, if you eat really bad, and you develop cystic like acne, or you don't wear sunscreen and you get, a lot of sun damage, all of those things play a factor. You can do Botox all day long and you can prevent the wrinkles, to some degree. But if you don't have good quality skin integrity, then you're not really doing yourself, you're really doing yourself a disservice because you're paying all this money to get your Botox, but you really need to do those do those appropriate skincare steps to complement your Botox. So that way we can help you age like fine wine. That's the goal, right? You want to age gracefully. We're all going to age, but we don't want to do it too fast. So all of those things matter.
Okay. And you brought up a very interesting point. You mentioned as far as even the food that you eat is going to affect your skin, which I think not many people think about. You think
Right.
about skin health, like, okay, the sun, like
Mhm.
that makes sense. I should wear sunscreen.
Mhm.
I shouldn't be in the sun too long. Smoking, I guess maybe people will be like, okay, I guess that kind of makes sense. But I don't think
Mhm.
people intuitively think diet,
Yeah.
what you eat really plays into skin
Absolutely. How
health.
much water you drink, fatty foods, gut health, it plays a big, big role. I can tell a difference in if I eat out a lot, if we go on vacation and I'm eating out and I'm eating not really great options, then I notice it in my skin. If I'm not drinking enough water, I notice it in my skin. And that's something that I was not very good at. And then once I went into aesthetics, I realized the importance of it. And now I'm making sure that I'm drinking all my water every day. And if I don't, I can tell it. I can see it in my skin. I'm not as glowy. You start to have little breakouts. It's an extremely crucial thing to watch your diet.
Okay. So for people who are not aware of the diet portion of skin health being and having that ounce of prevention, what are some places that you would recommend that they start as far as, and you kind of mentioned a little bit like hydration and some food, but
Mhm.
like if someone just came in and said, Megan, where do I start? I have no idea where to start. What would be some tips you give to them?
Yeah, absolutely. Water. Water is the number one. Cut out Cokes, as much as you can. But water, chocolates, decrease in your chocolate intake and your candy intake, high sugary foods. Those things you need to cut out. The more that, you watch what you eat, less fried foods, all of those things. Just making smart choices. You don't have to be a nutritionist. Just being, aware of what you're eating and trying to, drink a whole water bottle. I have a water bottle and I know I need to drink, a certain amount a day. And so setting little goals like that is a great place to start.
Okay, got it. Great advice. Now, Megan, I want to dive deeper into the practice. So, what would you say really differentiates your practice from others in the industry? Because I think that the competitive landscape is getting very high, a lot of
Mhm.
medical spas coming out.
Yeah.
It really differentiates your practice from others.
I think that's a great question, and we are really proud of our practice specifically because we have really good estheticians and they have been in the field for years. So they know better than anybody appropriate skincare. They, will guide you and spend time with you on what will work for you. We customize all of our treatments. What works for me won't work for you. And so we're really proud that we take that time to kind of take that extra step with our clients and spend that time with them to understand what works and doesn't work for them. Are they are they going to stick to a 5-step regimen, or do they need a really good 3-step skincare regimen to be compliant? Because we don't want to give them something if they're not going to realistically do it. And that's with every treatment. That's with our That's with our weight management program. That's with our lasers. That's with, our M Sculpt, our body sculpting machines. That's with our Botox. Our whole office is trained for wraparound care. We don't just come in and treat your laser hair. We want to know, what's bothering you. And so we're really passionate about treating the patient, not just the procedure. And that's something that we really pride ourselves on, and our patients feel it too. We have really good trained consultants. And so all of it, we like to think that we're a family with our patients. They really enjoy just coming in, and they know also we're going to be very honest with them, and we're going to do it very safely. We want you to get things done and still maintain your natural beauty, because everyone's beautiful. We just here to perfect the packaging, right? So we just want to help them get there, and remind them of how pretty they are and how we can do that. And so it's not just giving them Botox, it's giving them their confidence back, and giving them their life back. Honestly, there are so many little tiny tweaks and stuff that we can do for someone, and you just have no idea how much it's affecting them. So I think that's very unique. And also the medical aspect of it. We're one of the few practices that has, a full-time nurse practitioner in Tennessee, and RN can inject. And so because I'm in here, we're not only just injecting, I'm able to provide a holistic approach. I just had one of my girls come to me because she was treating a patient with a hydrofacial, and she keeps having breakouts and she can't understand why. So I popped in, I had a long talk with her about her hormones and different things. And that's just something that we're able to provide because we bring that extra level of expertise to it. So I think that really sets us apart.
Awesome. Great answer. Now that you brought that up as far as like the level of expertise, I do want to bring up this topic, which I do hear from time to time, where consumers they're just looking for the cheapest option. So they go to somebody that maybe got their product off of Amazon or
Yeah.
Temu, and they're injecting
Mhm.
in their garage or in their backyard. Could you talk a little bit about that? Like, what is really the dangers or potential dangers? I'm sure people have done it, they have not had any issues, but there's also a lot higher cases of issues coming up. So could you talk a little bit more about like, what's the potential dangers of going down that path? People that just want to go really, really cheap and like, oh,
Mhm.
this person is charging $100, this other one's charging
Mhm.
500. Why would I go to the $100 one? They can't be
Mhm.
5 times as bad, can they? But
Right.
tell me a little more about that.
Yeah, and that's something we face every single day. Here in this area, we get a lot of that. They'll call our office and they'll say, "How much is your Botox?" And we tell them, and they're like, "Well, I can get it $3 cheaper, $4 or $5 cheaper down the street." And, all we can do is say, we're not sure, what they're offering. We have no idea. All we can tell you is that our product is, FDA approved. It comes directly from the manufacturers. We cross our T's and dot our I's on all of our stuff. We don't risk anything because safety is our number one priority in this office. There is no way that, doing it out of a garage is safe. And unfortunately, that's a common thing. And we get that a lot. And I just tell them that, here you got to realize that you're not only paying for good product, but you're paying for, expertise. And there are so many different things that you have to, when I inject someone, I'm not just injecting a forehead. I'm looking at the way their muscles move. I'm thinking 5 steps down the road. I'm educating them if I'm doing lip filler on them, and I'm telling them in 30 minutes, I want you to be aware of these signs of complications. I want you to think about this. In an hour, think about this. In 2 hours, think about this. That way, I'm educating them, because if they know the signs of a complication, the sooner they recognize it, the sooner they call me, the sooner we intervene. Those are important. And those things, I know who's at high risk of that a little bit more so than others based off of anatomy. And that's something that my expertise, and especially my experience in vascular, brings to the table, that I can pick out somebody that I'm a little more cautious on versus someone who's just injecting in a garage. So it may be cheaper, but this is your face.
Yeah.
And that's my response to him. Well, this is your face. So how much are you willing to risk?
Mhm.
Because that's something that, I mean, I don't want just anything in my face.
Yeah.
I want to know that it is appropriate.
Yeah. And I think the educational part of this is also really important. Like this part, like educating them that, hey, like, what's the difference in the price? Like, can it really be a half? I mean, are you twice as good as this person? If you're twice as good, like,
Mhm.
it can't be that off, can it? But in many situations, it can be. So when it comes to the educational part of it, like, How do you educate your clients on really the benefits of the treatments and also even the potential downsides of the treatments? Like, what's your approach to educating them?
Yeah, I'm very, very passionate about the patient having a full understanding of all the risk and benefits and the expectations. We set the expectations on their treatment. They come in and they think they know what they want, but then when I sit there and I listen to what they want, it's different. And so, I spend a majority of my time just educating them. They think they know what Botox is, but really they may want filler there, and really they think they want filler, but no, they really just need a little dose of Botox. So a majority of my time spent with them is, this is what it is. And I give them the science behind it. I break it down to the pathophysiology of how a neurotoxin affects your muscles or how filler can cause a complication. And I make sure that they are completely well informed and they have time to ask questions and that our expectations are very clear on what to expect, even down to they may experience a little bruising with a Botox injection. So I want them to walk out of my room knowing I feel good because if I'm going to have a complication, I know what I'm looking for. And so I think education is the number one thing that I'm extremely passionate about is safety and education.
Now, you did mention that sometimes people come in and they think they want one thing, but they really need something else. What are some of the most common misconceptions or myths that you hear from your clients that come into the practice?
A lot of misconceptions is that filler makes you overfilled. That's not true. That's a lot of times the ones who are getting it in the garage. Filler can give you a very natural enhancement, and that they come in and they really want lip filler, but they're terrified of it because they don't want duck lips. And so that's when I bring out before and after pictures. I'm really big on showing them, expectations and how filler. It's a myth that you're going to be overfilled. You're going to look like, a Hollywood person who's had way too much done. And that's not true. You can keep a very natural appearance and just enhance it a little bit. So I think just reinforcing that is very important and a lot of times makes them at ease. And then they're super happy after they decide to go with it once they understand that I'm not going to let them look fake. We're going to keep you very natural. So that's a big thing. And Botox, they're all scared. One of the biggest things that I hear is they're all scared of spiky eyebrows.
Hmm.
And so that's, something that I'm always explaining the pathophysiology of the muscle movements and different things. So that way they can feel at ease with it. And then they all come back and they're like, I love my Botox. So simple little educational things like that really makes a difference. And then it also builds trust. If you educate them and you explain to them, then they trust you and they're gonna pay that price because they don't want anybody else to do it. They love their treatment. So first time is sometimes just getting them over that hump to trust you, and then they're gonna be lifetime clients of yours.
Got it. Now, when it comes to the role of artistry in what you do, how important do you think having that artistic eye is? Because when people think about medicine, especially coming from the surgical side of it, like,
Mhm.
I don't think people think about, oh, when it comes to surgery, you need to have an artistic eye to it. But I think
Yeah.
when it comes to the aesthetic side, that becomes much more important. But I mean, what are your thoughts on the role of artistry, creativity in how you approach client patient care?
Yeah, you have to be able to blend them together. I think that a really good aesthetics injector is able to look at someone and is able to think science, anatomy and artistry. You have to be able to blend them together, and that takes skill. And the reason, an example of this is, for example, my best friend, she had a history of Bell's palsy at a young age. Well, she's always had uneven lips because of the Bell's palsy. And she had asked several times, is there any way to fix this? Is there any way to fix this? And she kept saying no. And every time she would go to try to get Botox or something, they would say, no, 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 you Bell's palsy, I'm not touching it. Well, if you just understand the muscle movements and how Bell's palsy affects it, then I told her, I said, let's just try a different dose of a lip flip. And, you don't need as much on one side as you do on the other. And that evened her out completely, and she was tearful. I mean, it's something that she had been looking for, for years. And all it took was me to understand the pathophysiology behind the condition that she had, why she is the way she is with her lips, and how Botox affects it and how we can fix it. And actually, I get that a lot. A lot of girls come in, not necessarily Bell's palsy, but they come in with uneven lips, or they come in with an uneven eyebrow, and not from Botox or anything, just naturally a little bit uneven. And they're always told like it is what it is. And all you have to do is understand the pathophysiology of the muscles, why they are like that, what is it, what's causing it, and then I just sit back and I come up with a treatment plan appropriate, and I can even you out. And it is what makes me love my job, because who would have ever thought that me blending my knowledge, my medical knowledge, with Botox can make somebody walk out of here and have more confidence than they've ever had in their whole life, because they feel good about themselves. And I love that. I love being able to give that to people.
Yeah, I mean, it's a very important point you bring up, because I think when people, like the average person, thinks about the aesthetics industry, they think, oh, it's all just about vanity, it's only about aesthetics.
Mhm.
Whenever I ask practitioners, like, what's the stories that really stick with you, the ones that really come to mind, it's always the ones where people come in with some type of, maybe not deficiency is the right word, but like something where they feel like they're not normal, they're not average, they feel under
Mhm.
that. They just want to feel like they just want to feel normal. They just want to feel
Mhm.
like their best self. And when
Right.
you're able to give that to them, then they just in so many situations, it just completely turns their life around, how they view themselves, their happiness, and just it's just going back to being normal. They just want to feel
Right.
for their best self. Not,
Right.
I want to
Absolutely.
maximize my how I
Yeah.
look. It's
Yeah.
almost never about that.
Yeah. Exactly.
Now, what do you think about, well, I want to go back to skincare. Like, what do you think people really get wrong about skincare, and like how you're able to help them shift their mindset about it?
I think that a lot of it is cost. And, it's realistic to understand that everybody's on a budget.
Mhm.
If you just tell them, well, you need this fancy skincare, but deep down, they're really worried about cost. And I mean, I'll say this as myself, as a mom, and mostly what we deal with are moms, they take care of everyone else before themselves. And if they know, my kid has a bunch of things coming up, I really don't need to spend $200 on skincare, they're not going to do it. So I think it's very important to get down to the root and figure out what is a realistic expectation for them, and then find something that meets their needs. So that way they feel better, and they're relieved, and they're not stressed, and they feel like they're actually taking care of themselves a little bit and not breaking the bank. So I think that's one of the biggest hurdles we have is budget, and making sure that we can give them, something that's realistic, that they're going to actually do and purchase. And then also, I think that trends are a big thing. And that's a big hurdle right now, especially with TikTok. People, I mean, with my daughter, like drunk elephant, all the kids think that they need drunk elephant. I'm not, saying anything negative about drunk elephant. It's just a trend. And so people see certain brands that are, recommended or trending, and so they think they need that. Well, then they go and they get a piece of this and a piece of that and a piece of a different brand, and they try to blend it all together because that's what's trending. And really, it's really important that maybe these are kind of, counteracting each other. So it's very important to get on a, regimen that complements each other. Maybe it's sticking to one brand. Maybe it's, getting two brands, but it's completely different. And so they complement each other. It's really important. You can't just get a bunch of different ingredients and expect to make a cake. So you have to get, appropriate ingredients, and give it to, sit down and meet their budget, because that's ultimately what they're going to stick with.
Now, you brought up a really good point as far as people buy these products, but they're not thinking about how they potentially interact with each other or even with your own
Mhm.
body. So, I mean, some people can use one product and it works really well for them. Other people use
Mhm.
the exact same product and it works very poorly for them. So, where would someone get started? It's like, hey, I'm on a budget. I see all these different types of products out there. I can use this one for my face. I can use this one for my hands. I can use this because it does this, this, and this. But how would they really figure out which one should I get? How are they going to interact with each other? How do I know if it's working with me for me or not? Like, what would be a place for them to start if they have these questions?
They need to see a skin professional, either an esthetician, a dermatologist, a nurse practitioner who specializes in aesthetics. But you can do a basic consult, and here in our office, we do skincare consults. You can come in and not have to buy a facial or get Botox. You can come in and have a sit down consult with us, and we can guide you on your skin needs. If you have pigmentation, if you have texture issues, if you're oily, if acne is an issue, then we can help guide you on what's appropriate. And we offer that service with just skincare. So not everybody, not every office you have to be scared of and think you have to purchase a service in order to get those, that high level of expertise recommendations. We meet with you regardless. We do all free consults, and we spend time with you, and we manage your expectations and guide you. That's what we're here for.
Great advice. So, Megan, what would you say then? What piece of advice would you give to somebody who wants to move forward with some type of aesthetic treatment procedure or just get advice on skincare, but they're not quite sure which provider to choose? Like, what piece of advice would you give to them on how to make that decision?
Well, I think that you can always start off with your primary care. Primary care, providers are really good at kind of guiding you. If it's something that, for example, like rosacea or anything like that, then maybe a dermatologist is a good option for you. For us, we are open and we are experienced in all different types. So anything that you're dealing with, we know how to guide you. If we can't do it, which is rare, but if we can't do it, then we know exactly who to send you to that can. So anyone who has experience and expertise in the field should be able to guide you and help, lead you down the right path of that.
Got it. Now, Megan, where do you think the future of SX is going?
I think it's booming. I think it's really growing. I think that it is becoming more, and what I hope to see with it is it's going to become more of a preventative medicine than just an injectables and like making yourself, feel good. I think that the medicine part of it is really kind of jumping onto the train. And so I think you're blending now aesthetic medicine, and that portion of it is really starting to become more predominant, and I love that. I see so much now that's preventative health, preventative skincare, sun exposure, different things, and people are really starting to realize, hey, I really need to take care of my skin. I really need to wear sunscreen. And so I think that aesthetics is just going to explode with prevention, and that's great. As a nurse practitioner, you're trained on prevention, whether it be breast cancer, colonoscopies, cardiac prevention, all the things. That's why we're so good. We look at you and we think of your whole self. Is your heart good? Is your lungs good? What are we doing for this? How can we prevent diabetes down the road? Different things. How's your diet? I think that is coming into the aesthetics field and playing a role now, to where you're not just seeing a bunch of injectables or laser procedures. You're seeing good medical grade skincare. You're seeing good diet recommendations. And so I think a lot of spas are now, taking a more holistic approach, and I love that. And I think the field itself is looking at a more holistic approach and treating the patient and preventing, complicate medical complications down the road.
So it's really combining the wellness portion with the aesthetic side of
Mhm.
it. I guess another way of putting it is before with aesthetics, I think people thought of it more from an outside in. So you fix the
Mhm.
outside and basically hoping not to fix the inside. But what you're talking about is the wellness, the holistic side. You're really fixing the inside, and that's going to be reflected on the outside. Is that
Yeah,
correct?
absolutely. Absolutely. I talk to all my patients when they come in for Botox. I ask them all, have you seen your primary care? If they're a woman and, in the appropriate age range, have you had your mammogram? Have you, you're 50, have you had your colonoscopy? I'm constantly talking to my patients about not just I'm not just standing there injecting them. I'm talking about, have you had your cholesterol checked? Have you done this? Have you done that? And they are shocked
Mm.
and they love it. And they're like, well, no, now that you mention it, I haven't. And then I educate them. Just this morning, I did Botox on one of my clients that comes in all the time. And I said, you got sunburned. And she said, yes. And I was like, you've got to wear your sunscreen. You got to wear a hat when you're out. I can tell it in the integrity of your skin. It's going to affect different things. And so we talked about that. So I'm constantly, educating them. And so when they come see me, they're not just getting Botox. They know that they are getting a medical expert who can guide them and who can say, hey, you need to follow up with your primary care provider about this and different things. And so I think that the field in general is starting to kind of change its mindset of you're not just injecting them. You want to see the patient in general become their best self.
Okay. Now, Megan, what is the vision for A Beautiful You Med Spa?
So the vision for us, I would say, is, our number one thing is our community. We love our community. We love our patients. If you walk through our doors, you feel like you're at home. I mean, our patients say that. They say that I just feel like I'm at home. We've had patients who've lost their husbands and they will come and get a facial just because they need somebody to talk to for the day, and they'll hang out with us for a few hours and they'll bring cookies, and they just feel at home here. And so, as we grow and continue to grow, we're getting busier every day. I think it's important to continue that. We want everyone to know that they can trust us. We're not here to just sell you something. We're here to help you and take care of you and give you your confidence back in whatever way that may be. We want to support you. So I think, the vision for us is just to continue to grow and make an impact on the community and help everybody feel their best self. They're beautiful. We're just here to help the packaging.
Very well put. Now, Megan, I have one last question for you, but before I ask it, I do want to point people to your website at abeautifulyoumedicalspa.com.
Yes.
Now, the last question is, what does beauty mean to you?
Beauty to me means confidence. I think everyone's beautiful, but if you don't feel yourself, then how can we get you there? Because and that's something that I've learned being in this field. I had no idea how insecure people were over the smallest imperfections. That's something that I would have never noticed on them significantly bothers them. And if I'm able to give them a little bit plumper lips, or tighten their jawline up just a little bit, or whatever that may be, or maybe they don't like the way their chin is on their side profile. And so if we're able to enhance that just a tiny bit, the way that I immediately see their confidence grow is just amazing. And that's what made me fall in love with my job and the industry. Is like, goodness, all I did was give her a little filler, and that's what it took. And they just feel so good about themselves. So, beauty is confidence. It's how you feel, about yourself.
Awesome. Well, there you have it, Megan sharing her expertise. So, Megan, where can people contact you in the practice?
You can text our office number anytime, and those texts can come directly to me, or one of our other girls in our office will answer you. And we have all experts here. I'm very proud of our team. I love being in this office, and we're all very close and we support each other. And we all know that safety and just good service is our goal.
Awesome. Well, Megan, it was a pleasure. Thank you for coming on. Thank you for sharing your message.
Thank you for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.